Welcome to Engage and Exceptional. I'm your host, Jessie Lynn Gillespie. In today's episode, we feature Damon Harbison, hospital president in our Southern Illinois region. We will learn about his SSM Health journey and what has been most helpful in his own development. Hello, Damon. Thanks for joining us. We are so excited to learn about your SSM Health journey and what our team members here can learn as they explore their own career growth.
It has literally started on day one. I was born at one of the hospitals that I'm president at now. So I was born at St. Mary's Hospital in Centralia, Illinois, and that's where it all began. At that point, I didn't know I wanted to be a hospital president, a little too fresh, but as I grew up in the communities that we serve, when I was in high school, I really loved business and I really loved medicine, and I couldn't quite decide on how I wanted to break in, but I knew I wanted to be in healthcare. So when I was 16 years old, I actually got my first job at the hospital, scrubbing pots and pans, cleaning dishes, and working the front line behind the scenes for the patient. I was at St. Louis University Hospital, and this was prior to SSM Health acquiring them. And I absolutely loved the institution. I was there for 10 years, and we had a partnership with SSM where we were bringing some of the greatest technology in radiosurgery to SSM Health as a partner out west of St. Louis. And through that engagement, I met so many amazing leaders within SSM Health, and there was a glow about them, the glow of personality, and they were just so happy. And while I was very happy where I was at, after a couple of years on this project, I can only say that it's mission envy. And it was something that I was lacking in my current position at St. Louis University Hospital. But I would look over the fence at my friends over at SSM Health. And finally, one day, my good buddy, Jerry Rumpf, who's now the president of Lake St. Louis, convinced me to be his partner over in St. Louis. And he would take the North Operating Group and I would take the South Operating Group. And so I became the executive director of diagnostics and therapeutics. I was tapped on the shoulder to say, hey, would you want to be the executive director for Cardinal Glennon? And so I continued on with Cardinal Glennon for about 6-7 years. And through that experience, I took on other roles as the vice president of operations at Cardinal Glennon, then the chief operating officer at Cardinal Glennon, even interim president, before taking the role in Southern Illinois, where I'm now the president at St. Mary's Hospital in Centralia, Good Samaritan Hospital in Mount Vernon, and what we call the Rural Health Network for Southern Illinois. I already had my master's in business administration coming into SSM Health, so in my book, I was done for a while. So I didn't get any I did not get to utilize the tuition reimbursement or any other educational things, but what I have done every day since I started SSM Health is to take advantage of every professional development program that they can throw out there. Also, another one, especially as I've grown in my career, is I also look for opportunities in formation. One of the biggest responsibilities that I have as a leader within SSM Health, and one that's always on my mind, is how do we continue the heritage and mission of our founding sisters? For example, I'm in executive leadership formation now, or in the third cohort, and things are just, I love it. You develop bonds with the group, with the teachers, and really relationships that will have lifelong. And I couldn't be more happy with those programs. I can't even fathom trying to name each one of those leaders and mentors, because at every step in my career, I've always had a handful that are around me, and whether some people call them their cabinet or their brain trust, those that just continue to encourage you. You have the same goals in mind, the same drive, and you're making things better together. And I think I'd sum it up in one word, and it's thriving. When you're around the right folks, you're going to thrive. A few tips and tricks about continuing your professional development and continuing your career path within SSM Health is the word yes. Say yes to that invite, to that next meeting. Say yes to being vulnerable and stepping out of your comfort zone. Say yes when the system taps you on the shoulder, or even within your ministry, a new project, a new team, a new acquisition. Say yes. It's not going to hurt. You're going to learn so much. You're going to develop relationships that you'll probably have for a lifetime, and it's so rewarding.